Hi, I'm Steve Wesselingh. I'm the CEO of NHMRC. I initially trained as an infectious diseases doctor, and actually my first job was head of the Infectious Diseases Unit at the Alfred Hospital. Subsequently, I was the director of the Burnett and then Dean of Medicine at Monash University, and then the inaugural Director of SAHMRI. But since that time, I've been the CEO here at NHMRC and really enjoying myself. NHMRC plays a number of roles. Our most profound role is our funding role. So we give out about $1 billion of research funding every year, predominantly investigator-led, to our investigators, to our clinical trialists, and to other schemes. But we also have strategic schemes or priority-driven schemes like targeted calls for research, and our work with international collaborators like the MRC or the EU. We also work with the MRFF, which gives out about $650 million a year, and we do all the peer review and grant allocation for the MRFF. The NHMRC also oversees integrity, so that's a really important job in ensuring the integrity of research that's conducted in Australia and ensuring the public's confidence in what we do and therefore the social license we have to do research. We also have a big role in ethics, and we accredit the human research ethics committees all over Australia, and that's a critical role in enabling clinical research to be conducted in Australia. And finally, we write guidelines and endorse guidelines, and I see that really as the right-hand end of the translation continuum. So going all the way from basic research all the way out to a guideline, I think is a really important pathway that in the end impinges on decisions made by clinicians and patients. This is a really important time in health and medical research. I think we're all aware of some of the things that are happening overseas, some of the concerns around vaccines, and some people are trying to diminish the trust in science and the trust in our institutions. And we have to fight that. We have to indicate very strongly the benefits of health and medical research, the importance of science, the importance of health and medical research to a country, to its democracy, to its institutions. And there are people who want to pull some of that down. And I think it's important that we as researchers, we as clinicians, and the media work together to tell the stories about the benefits of health and medical research. We will not increase longevity, we will not save more lives unless we do more science, unless we do more high quality science. We will not reduce deaths to malaria, we will not reduce deaths to breast cancer. I mean, let's just think about breast cancer. It's been an amazing story from, high levels of mortality associated with breast cancer to now where we have amazing screening programs, admittedly a lot of women being diagnosed with breast cancer, but then amazing treatments available which are either curative or prolong life for a long period of time. So that's an amazing story, and one that was built on science, starting with very basic biomedical science all the way to very large clinical trials. We have to tell those stories. We have to make sure the public understands the importance of science and medical research, and the importance of support and social trust and that social contract that we have with the public in regard to health and medical research. One of the areas at NHMRC that we really see as very important, and that is embedding research in health, embedding in research in clinical care. And I think there's very strong evidence that when research is embedded into clinical care, the clinical care is better and patients benefit. They benefit because of the quality of the care, but they also benefit by being enrolled in clinical trials where they get access to drugs that they wouldn't normally do, or devices or diagnostics. We also think there's a really strong equity issue there too, and as part of the strategy and as part of our work at NHMRC, we're really keen to see research embedded in clinical care right across the country. It's not enough for it to only be embedded in metropolitan areas or in very big institutions, say the big hospitals or the Peter Mac. We need to see research embedded in clinical care right across the country, in rural, remote, regional areas, everywhere, because it's unfair otherwise that some people are going to get better clinical care because they're seeing the benefits of research, say, in a metropolitan area and not in a regional area. So we've got to make sure that it's across the board, that clinicians have access to research, they have access to the benefits of research right across the country. Every year at the dinner after one of our council meetings, we have an awards event. And what we do there is give out awards for the very best researchers in the country. Some of those awards are decided on who gets the highest score for their grant application. So the Research Excellence Award is about the person who's written the best grant with the highest score in the country. We also have biennial awards, which are about people who've contributed to health and medical research in Australia and particularly with NHMRC. And we have another award, the Science to Art Award, where we get people to put in their best pictures which relate to pictures of proteomics or pictures of histology or radiology or whatever, and we pick the best one, and that's the winner of the Science to Art Award. So we believe these awards are really important in highlighting the very best of Australian health and medical research. The other thing we do is publish the 10 of the best. And here we look at all the grants that we've given over the last 5 or so years, and we see which ones of those have achieved the most. And we then give out each year the 10 of the best, the 10 NHMRC projects that we think are the best for that year, really highlighting translation, the movement from science to clinics. And you know, they're really highly regarded, and they're in a little publication. And we think that's also important, particularly in letting the public know about the work that's being funded by the NHMRC. At the moment, it's a really exciting time for health and medical research because we are, for the first time, writing a national health and medical research strategy. We've had some reviews in the past, the McKeon review and the Wills review, and they made some really great recommendations, but we've never actually had a national strategy which includes not only the federal components, but also the states, also philanthropy, and also industry. So we're trying to bring that all together.
I will now hand over to you, Rosemary, to further introduce yourself and to provide some of your initial thoughts in relation to the strategy and its development.
Great. Thanks very much, Natasha, and thanks to all of you who have joined us to participate in this webinar today. It's a real pleasure for me to join you. This is like the first official occasion, I think, for the development of the National Health and Medical Research Strategy. We're also hearing that there are inadequate levels of research translation and insufficient measures of research impact. This includes a lack of investment and skills gaps in taking research outcomes to scale and a lack of accountability for research outcomes. I think there is opportunity to consult more. I mean, as I said, we're in the relatively early stages of the strategy at this point. And of course, when we get to that draft strategy and being able to begin the more detailed consultations, there will be plenty of opportunity for roundtables and the like that focus on particular elements. So please, you know, from private sector, people who might be online here, please stay engaged and in touch with the strategy. You know, there's a written submission process as well, but I am keen to continue those engagements.
We've had 2 webinars and a lot of people logged in, and we had really good engagement. We've also been talking and consulting with a lot of groups around the country, and we've also done some work or put out to external consultants some work on the funding landscape, on the workforce, on international strategies. And so we think we're really well prepared to develop our draft, and we are hopeful that we'll be able to release a draft probably by the end of June, early July. Importantly, the Minister's appointed a chair of this process, Rosemary Huxtable, who really understands government, but also understands the landscape and the states and the interaction between the federal government and the states. And Rosemary's been doing a fabulous job. So I'm really confident that that first draft is going to be pretty good. And then we're really keen for people to give us feedback, to basically rip it apart a bit and tell us what they like about it, what they don't like, so that by the end of the year, we can have a fully worked out strategy that can be released as our first National Health and Medical Research Strategy. I think it's really important that we measure the impact of what we do. Because as I said, we give about $1 billion away every year. The MRFF gives away about $650 million a year. So $1.6 billion of taxpayers' money going to health and medical research. We really have to be able to say, what does that achieve? And we do that in a number of ways. We obviously document very clearly where the money goes and who wins the money and what they work on. We also look at the impact of that by looking at simple things like bibliometrics, publications, but more importantly, we look at when that work creates a new drug or a new device or a new diagnostic or a policy enhancement or a total change in policy. These are the really important outputs that we are measuring. And so recently we did a very big study looking at the last 20 years of funding for diabetes and dementia from the NHMRC. And we were able to, using large language models, really look at the impact of that research on changing the management of diabetes, on looking at new interventions and looking at new policies. And it was really exciting to see the enormous impact in both of those areas, utilising NHMRC funding to truly change the care of patients in Australia. When measuring the success of health and medical research, there are a number of ways you can do that, and I've mentioned a couple. But in addition, you can look at the economic value of what you can do. So you can look at every dollar spent on health and medical research and how many dollars that either saves or creates in the Australian economy. And certainly AHMRI has done some of that work, and we're keen to continue to do that work so that we can have that economic view of what we've achieved. The other important thing are the sort of narratives or the case studies. And certainly every year we write a number of case studies on research, sometimes which has started some time ago, 10 or 20 years ago, that has led to a significant outcome. And, you can obviously think of Gardasil or Cochlear, but there's lots of others, a number of vaccines that have been developed by Australians, a number of inputs into childhood care, a number of inputs into intensive care. And these are all funded by NHMRC. And those narratives are really, really important because they resonate with the public, they resonate with clinicians, and they also resonate with politicians. A lot of people ask me, why did I move to the NHMRC? And really it was for a number of reasons. I'd been a clinician and a clinician researcher for a long time, but really interested in the development of policy and particularly national policy. It's been really exciting to look at this from a national perspective and to develop ideas, policies, funding opportunities, international collaborations at a national level. And I think here at NHMRC, we have done some extraordinary things. We've done some extraordinary things in gender. We've done some amazing things in Aboriginal and Torres Strait Islander. We've supported, the very best investigators across the country. And I think when I go overseas to meetings overseas, people talk about the strength of Australian health and medical research and the impact it's having. And I think that is terrific both for Australia, for our researchers and for our clinicians.